Hey everyone, my name is Dr. Stephen Kent and I'm with Skincare Physicians of Georgia. And with September right around the corner, I thought we would take some time to talk about a special awareness month. September is Alopecia Areata Awareness Month. A lot of people may not know what alopecia areata is, and basically it's a form of hair loss. Usually thought of as or related to a dysfunction of your immune system or an autoimmune related cause of hair loss. And it can affect anyone from infant or toddler age all the way into the elderly. It can be somewhat distressing for people. Hair is on top of our head and we wear it. But I think that, it's important to talk about what it looks like, what it means, and what you can do for it and how you can treat it. Interesting factoid about myself, I actually developed alopecia areata at a young age, right around 1. My mom noticed it, and I've had it ever since. I look like I do now since I was about 12 or 13. And I never did anything about it because it wasn't something that I thought I needed to do, and everyone just treated me like every other kid, so I was very lucky in that regard. But I think, on that note, it's important to just remember to treat the patient and not just the hair loss. What does alopecia areata look like? Well, it has many different forms. Most commonly, we think of it being little patches of hair loss, usually circular on the scalp. But it has other different patterns. It could just affect your eyebrows. It can affect other parts of your body, your armpits, and it can affect everywhere. It can just be localized to the scalp. In that case, it's just localized alopecia areata, but it could also be generalized for the full body. We call that universalis. And it can be very distressing for people and have a big impact on their social and family and really any aspect of their lives. So how do we treat alopecia areata? It's a personalized approach, and we really want to treat the patient, not just the hair loss. But if you're going to treat, it really depends on the extent of the hair loss. And if it's localized, just one or a few areas of patches on the scalp, then we can start with local therapy, topical or injection. All of these therapies that are aimed at calming down the skin's immune system. And so what happens if the hair loss is more extensive? Maybe it's not just on your head and neck, maybe it's getting onto your eyebrows, your arms, your legs. And so at that point, really we start to think about addressing systemic therapy or therapy that you may take as a pill or a shot that's aimed at calming down the body's entire immune system to try and calm down the hair loss. And that can be tricky, and we want it to be personalized. And so there are many different options for that, and we would be happy to discuss that with you in person if that is affecting you at this time.